so much. All right, well, let's get things started. Okay, so today's webinar for today, for Thursday, December 19th, can't believe it, it is going to be the update on foundational community support, also known as FCS. And today we'll talk about the tools, resources, and technical assistance. So before we get started, let's make sure that we're connected. So we've muted all attendees, which means that you can hear us, but we can't hear you. There'll be a Q&A session at the end of the presentation. So feel free to send us your questions throughout the webinar. We'll get it queued up, and then we can answer those questions at the end. And you can ask questions by typing them out using the panel on the right side of your screen. So for those folks who raise their hand to say, yes, I can hear you, that's where you'll plug in your question. We're recording this webinar, and in a couple of weeks, we'll send you a link to the webinar, and we'll provide you the slides and the slide deck from today's presentation. Okay, so today's panel, very excited to introduce these folks. First off, we have Melody Pazos. She's a section manager here at HCA, and she works in the Division of Behavioral Health and Recovery, also known as DBHR. We also have Greg Claycamp, and he is our FCS program administrator here in DBHR. Matt Christie is also with us, and he's our FCS program manager within DBHR. And I'm hosting today. I'm Rochelle Alonji, and I am the policy communications manager here at HCA. All right, so Melody, you're up.
Thank you very much. It was great to be here today. It is hard to believe it has January 1st. It will be 2 years since we launched Foundational Community Supports. And certainly the 1115 Medicaid Transformation Demonstration has been operating for 3 years, and we got a little bit of a late start under Foundational Community Supports. So we wanted to kind of circle back around, sort of celebrate our 2-year anniversary by giving everyone an update. But it's great to also remind everybody that the whole 1115 Medicaid Transformation Demonstration has a number of activities that are focusing on social determinants of health. And so I know that each of our accountable communities of health have projects associated with social determinants of health. We're looking at trying to examine how social determinants of health and managed care purchasing and employee benefit purchasing are all working together really to operationalize how whole person care is implemented in our state. We have a lot of moving pieces in Washington. One of my favorite sayings is that it's like trying to build an architectural plan in the middle of a hurricane while traveling in a foreign country. The last couple of years have been so many changes with integration of our behavioral health system into the healthcare authority, into integrated managed care, and even with DBHR moving from DSHS to the healthcare authority 1 year ago. I think actually last year we were moving into the healthcare authority as we speak, at this same time last year. So a lot of changes happening. And it's so exciting to see the impact that Foundational Community Supports has had over the last 2 years on bringing new services to our state to focus on these really two important pieces of a whole person care. So today's webinar is really just to kind of do that little refresher on what is Foundational Community Supports, give you an update on what we've been up to over the last 2 years since we launched FCS. So Matt and Greg are going to do a little bit of a deeper dive into the data, refresher on what FCS is, where we're at. But we also just kind of wanted to take a step back and just remind folks about why these two new benefits were important for our state to launch. One of the reasons, particularly why we wanted to focus on employment, and a lot of people I've encountered over the years have said, why are you focused on employment when that's not really a health issue? Well, it actually is. We know that when you're unemployed for long periods of time, you have poor health, and that you oftentimes lose your health insurance, so you can't get your other health conditions taken care of. And there are research studies that show that when you're unemployed, you're more likely to experience physiological issues such as increased stress and blood pressure, We know that higher rates of cardiovascular disease, diabetes are more likely to be out of control when somebody's unemployed. We know that when somebody's unemployed, they also tend to focus on unhealthy coping behaviors, such as increased drug and alcohol usage. And we know that being unemployed is also linked to increased depression. So we know from the research that these social determinants of health are, particularly around income support or employment, are really a key part of whole person care. And of course, housing. We heard from the governor yesterday as he launched the announcement for his budget about the new renewed focus on addressing homelessness. And so there's tons of research that shows that being unemployed or being homeless affects your health as well, and that housing interventions decrease costs. We know from some of our own local celebrities at DESC, Downtown Emergency Services Center in Seattle, that had a JAMA report that demonstrated how housing individuals through a housing first model, where we actually house people first and then wrap supports and services around them, that we saw pretty significant decreases in their utilization of higher cost services, and people fared much better, their health improved. So there's a ton of research that shows that by addressing housing, it reduces other costs in other areas. And so that's one of the reasons why in Washington State we wanted to focus these new benefits to try and address these issues. And you know, the existing service delivery systems are complicated. Housing is just so complicated. It's the capital, the bricks and mortar. We always kind of reference it, the four legs of the stool, to really provide housing supports to individuals. We need more bricks and mortar. We need more affordable housing buildings that people can move into immediately. We need more subsidies, ways to develop and pay for housing, including fair market rent housing and private market landlords. And so how do we actually do that when there's very limited resources? And so we know that the Homeless Safety Net has actually been using their dollars for services over the years. And so the opportunity to actually have a Medicaid benefit that provides the services to help somebody with housing and really allow our Homeless Safety Net, our housing system, to actually use their funds to focus on that. So, and for folks that aren't familiar with the fourth leg of the stool, which is operations and maintenance, where it's really, you know, a building that builds an apartment building needs to be able to replace the carpeting, the painting, and that's operations and maintenance. So it takes all four of those legs of the stool working together to try and solve our housing crisis in Washington State. And the FCS services are this new resource that's coming in to that fourth leg of the stool. Employment, similar. Next. That there's, you know, no, yes, thank you. That, you know, employment resources are also complicated. We have some fantastic resources through apprenticeships, the Job Corps. We have our workforce centers that have the Workforce Innovation Opportunities Act, the Senior Employment Program, the bonding program. There are a lot of resources, but those are fairly self-directed resources. You know, you have to be able to navigate these systems to be able to access housing and employment resources. There's also the TANF program has their workforce program, the Community Jobs program. And then there's the Division of Vocational Rehabilitation that provides some really intensive services, but not to a lot of people. And so there's a lot of populations that are kind of falling in between these systems. And that's really, again, where supported employment through our FCS services can try and address that gap that's missing for folks that have significant barriers to employment and aren't able to access these other mainstream resources. So to do that, we started getting ready for implementing supportive housing and supported employment. The list of the next couple of slides are actually kind of a bulleted list of some of the things and tools and resources that we've been developing in preparation for launching FCS services. And we just kind of want to refresh everyone to know that these resources are out there. This is not an exhaustive list, and we're continuing to build upon this and add to this list as well. And if folks see needs of what they need to really implement supportive housing and supported employment more successfully, we really encourage you to reach out to us because we're pretty proactive in trying to go out and access additional funds to be able to address missing links or gaps in implementing and being successful with foundational community supports. So just a couple of highlights. So one, this foundational community supports is a Medicaid benefit, and as such, we have to be able to help our providers that are providing these services to be able to document in a new way with a Medicaid lens. A lot of I oftentimes say that we're kind of doing two demonstrations. One demonstration is we're demonstrating supportive housing and supported employment and the effectiveness of this. The other demonstration that we're kind of doing is we have a lot of non-traditional providers that we're working with that are providing supportive housing and supported employment and haven't necessarily provided a Medicaid reimbursable service. And so we're trying to give them tools not only to do these services, but also learning the new Medicaid system. And so that includes how to document their services. We've also created a learning collaborative approach. So I'm quite use a lot of metaphors in my presentations, and I really think that foundational community supports implementation is a little bit like a Sudoku puzzle. If you know Sudoku, you have to get 1 through 9 vertically, 1 through 9 horizontally, and 1 through 9 in the box. Part of this presentation or part of the implementing FCS is we have to meet Medicaid requirements. We have to get that 1 through 9 in the box. Medicaid is pretty prescriptive in what it takes to satisfy their requirements, including documentation. But then we want to try and follow evidence-based practice models. And so what's the fidelity? What's the recipe for those models? And the other axis that we're trying to is also making sure that we're getting good outcomes. And so we're really trying to do all of those things within the implementation of FCS, including learning from each other on how do we implement these evidence-based practice, supportive housing, and supported employment models. Both foundational community supports, the Healthcare Authority, and our partners at Department of Social and Health Services, Aging and Long-Term Care Services Administration have staff that can help agencies implement these services, provide them technical assistance and support around the services that they are providing, and we will have some more information about that as well. Both our DBHR and our ALTA staff are out there available to support agencies. Please feel free to reach out to us. Also, our third-party administrator, which Greg will be talking about, also has resources and support for agencies to help them be successful. We can't do this without really be successful without adding housing subsidies, such as our Housing and Recovery Through Peer Services program, our partnership with Department of Commerce in terms of long-term subsidies. We've got a workforce that we have to develop, and so we've been actually working on accessing and trying to promote using our people with lived experience, our certified peers. And so can certified peers provide supportive housing and supported employment? So we've created some continuing education curriculums. These are actually available online and for anybody to actually use. We also have AntiStigma campaigns, such as our Great Minds at Work campaign for employers to hire people with behavioral health conditions. We've created a lot of tools, such as telling stories through photo voice. And so there's some really cool messages from our photo voice program. We've had conferences. We do monthly housing webinars. We do monthly employment webinars. We have a monthly job development learning learning community. We've got our housing specialist training, and last but not least, we have our foundation's newsletter. Melissa down here at the end of the conference table manages. We're almost up to 2,000 people on our listserv for the foundation's newsletter, so that's really exciting. We have a lot of things happening. We also want to create tools for our stakeholders to be able to refer individuals to. We really wanted to create a no wrong door in how people get access to FCS. So individuals can contact our third-party administrator directly. They can contact providers directly. Agencies can refer to our third-party administrator. There's even a referral tool that's on the third-party administrator website. But if you are interested to know which agencies in your community are providing FCS services, we created a Tableau map that is available on the Healthcare Authority website. This, on the right-hand side, you'll see this long laundry list of agencies that are under contract with AmeriGroup, or you can hover over a particular county or a particular region. It's color-coded which agencies are providing employment, which agencies are providing housing, and which agencies are providing both housing and employment services. So that's another tool in Community's toolbox. The next slide is a little bit of we really wanted to do a little bit of a deeper dive today, and I can't emphasize how great our tools and our partnership is with DSHS and research and data analysis on the pathways to employment and the pathways to housing sites. The pathways to employment has a plethora of information, and for individuals that are really hesitant or fearful of going back to work, the pathways to employment was really started as a benefits estimator. It was a tool to really help educate individuals so that they can make informed decisions about going back to work and how working was going to impact their governmental benefits. It has become more than that, and I'll talk that through in just a minute, as the next slide is going to give you a slide of the face page of the Pathways to Employment. We thought the Pathways to Employment was such an important site that we created a Pathways to Housing site to also focus on a housing version of Pathways to Employment. And so I'll again talk you through what those sites have to offer. We've also created some wikis to again share and learn from each other, share documents, share resources. And then last but not least, we're actually tapping into our international learning collaborative through our individual placement and supported employment international learning community. They also have a ton of information resources available to help agencies. And so we became part of the learning collaborative community in 2015. Next slide. So I just want to do a little bit of a deeper dive to kind of highlight what Pathways to Employment has to offer. So as you can see on the left side, there's quite a menu of things that Pathways to Employment has. It has the benefits estimator. And if you, again, have somebody that is really thinking about contemplating going back to work, this really gives people different scenarios of how working affects their governmental benefits. It also provides information on work incentives. So there's just a lot of great information. I can't emphasize enough the new work incentive tool that we have called Healthcare for Workers with Disabilities. The gentleman that I call the father of Healthcare for Workers with Disabilities, Steve Kozak, actually was the one who helped, he was the instrumental guy behind creating Pathways to Employment with a Medicaid infrastructure grant and created this benefits estimator. He's also the father of Healthcare for Workers with Disabilities, and in January, HWD actually increases its availability by taking off the income limits as well as the age limits so that people that are on SSI or SSDI can go back to work and buy into Medicaid. And for folks that are on spend downs, it completely eliminates the spend down. I know that they actually just did a webinar this morning on the Healthcare for Workers with Disabilities. And so if you're interested in more information about HWD, that webinar is actually going to probably be archived and available on the wikis. So we have lots of great information on that, on healthcare, how working affects people's benefits. The Resume Builder is also a fantastic tool so that folks that are looking for work but may not have money for a flash drive or access to computers from different areas, maybe they go to different libraries to use computers, they can actually create an account on Pathways to Employment and store their resume there. So they don't have to have that flash drive. It's a great tool for them. It also does cover letters. The Work Near My Home is a really unique feature. If you have somebody that's interested and not sure what they have in their local community, maybe transportation is some significant barriers to them, the Work Near My Home actually allows an individual to see what are the businesses that are actually in their close immediate geographical region. It doesn't tell you if they're hiring or not, but there's some unique employers that you may, or businesses that you may not even know are right down the street from you. There's, of course, the Veterans page providing resources. One of the unique things about the Veterans page is it takes the person to what they did in the military, and it transposes what are the transferable skills in the community for that veteran. And so that's a cool tool. There's a link to that on the Veterans page. For the behavioral health section, we created a page on how do you get started? How do you get your food handler's card? How do you get an ID? How do you get an occupational driver's license? Do you disclose or not disclose to an employer? It's a personal choice that every person has to decide when they're thinking about going back to work with a behavioral health condition. The Justice Involved page has a great tool on how do you talk to employers about having a connection with the justice system and being able to reframe your conviction and so or your justice involvement. So a lot of great resources. I'm not going to go through all of them, but I just want to touch on the last two. Continuing education, that's where we have those modules for our certified peers are available on there, as well as a number of trainings that we did and recorded with our partner with WISE, the Washington Initiative for Supported Employment. They did a series of trainings for us on the basics of how working affects governmental benefits, including HEN and TANF, and there are links to those trainings. Anybody can go in and watch those trainings at their own convenience. And last but not least are links to supported employment, as well as more information about the individual placement and support model, links to the FCS program. There's provider links on, if you are interested in starting FCS services, you can actually go in there and use documents, job descriptions. There's all sorts, because we want to make it easy for agencies to think about providing FCS services and supported employment. The next slide is just a little bit of a preview on our Pathways to Housing. This is our newest kid on the block with regards to this kind of a website. So we built it off of the Pathways to Employment, but with a housing focus. So it's only been around, I think, about 9 months. So this is brand new. We're still building out some of the modules. There isn't quite as much information on Pathways to Housing as there is on Pathways to Employment. So for just kind of going down the menu on the left side, financial wellness is really starting to build that financial literacy information for individuals. How do you get a credit check? How do you build your credit? A budget tool. So there's some financial wellness or financial literacy tools on that section. The rental application builder is that master application for individuals. Sometimes individuals are poor historians, and so having a master application of where they've lived can be helpful as they're going out and applying to rent to landlords. Supportive housing services, again, is that sharing of information. There's more information about the evidence-based practice. There's tools, including job descriptions, including all sorts of information. There are provider resources, as we have the links to those modules for peer support. We have a veterans page. We have success stories. And another important section is Know Your Rights. So there are links to a tenant on what their rights are. There's links for landlords on what their rights are. And there's also on the provider resources section a series of brochures that we did in partnership with SAMHSA And one of those brochures talks about the landlord mitigation program, again, another partnership with the Department of Commerce, to really provide incentives to landlords to rent to individuals that have public assistance. So again, really wanting to put as many tools as we can in the hands of our FCS providers, as well as anybody in our communities that are interested in addressing social determinants of health. I'm going to stop talking and catch my breath and turn it over to Greg to talk to a little bit more of a deeper dive in what is FCS.
Hello, everybody. So yeah, I'm going to speak briefly about what foundational community supports are and who is eligible for them. So what foundational community supports are Medicaid reimbursable benefits that support housing and employment. And for supportive housing, that means helping somebody find a home that they want and supporting them in staying in it successfully. And for supportive employment, finding meaningful employment that's identified by the participant as what they want to do and helping them find that employment at the point where they say they're ready to be employed. And that's really important within this model for both housing and employment, because these are very client-driven services where we're attempting to meet the client where they are at the point where they say, I want to be housed or I want to be employed. What these services aren't are subsidies for rent or a resource for paying background checks or for, on the employment side, paying tuition costs or certification costs or buying work equipment. So it's really important, referencing back to what Melody said before, to try and grade these resources with other strategic partnerships with DVR, with WorkSource on the employment side, with housing authorities, with various programs provided through the Department of Commerce, and other partners who either have affordable housing or have subsidies to purchase affordable housing. The next slide gives some examples of the kinds of services that can be reimbursed on the employment and housing side. And rather than go through them item by item, I just want to stress the nature of the services. We're really, for both housing and employment, looking at services that are provided either directly to a participant or advocacy that's provided directly on behalf of a participant. So one of the things to be really mindful of in both cases is when you're sort of generically doing outreach to create relationships with new employers or to investigate potential landlords in a generic sense, those aren't going to be billable services. They're only going to be billable when they're connected directly to the participant. I do want to stress that in both cases, we're not looking at just the initial job development or housing location, but we're also looking at support of the person once they've successfully become employed or become housed, because the goal of this program is long-term. The benefit is not time-limited. We can continue to support the participant for as long as there's a demonstrated need. Next slide. Okay, so this is not a general Medicaid benefit. This is a targeted benefit. So not every person who has Medicaid will be eligible to participate, but to participate, you at least have to have Medicaid. In addition to having Medicaid, there are some age requirements, minimum age requirements for participation. You have to be at least 18 years of age to participate in supportive housing, because in Washington State, that's the minimum age at which you can sign your own lease. And you have to be at least 16 years old to participate in employment, because that's the minimum age where you can legally work. Beyond that, you have to meet requirements for complex need. That means basically that the person satisfies some criteria for medical necessity related to either having a serious mental health disorder, substance use disorder, some significant impairment to activities of daily living, or a complex physical health need that prevents the person from functioning successfully or living independently without significant support. then beyond that medical necessity requirement, the person has to meet some specific risk factor that prevents them from finding and keeping a job or a safe home. And this slide gives you a list of what those criteria are for both supportive housing and supportive employment. You can see on the supportive housing side that one of the criteria is chronic homelessness. We have a large contingent of participants in this program who've experienced homelessness. It's also important to see that there are other ways to qualify for either supportive housing or supportive employment. A participant only needs to meet one of these risk criteria, not multiple. So it's homeless or history of lengthy stays, or frequent stays in residential care settings, or frequent turnover in in-home caregivers, or having a PRISM score of 1.5 or more. Similarly, if you look on the employment side, it's already qualifying and participating in the HEND program or the ABP program, or difficulty establishing or maintaining employment, having an SUD with a history of multiple treatments, or having a serious mental illness or co-occurring disorder. So that gives you an idea of what the range of participants are for the program. And I believe we are to Matt Christie.
So for this last part of today's webinar, I just want to focus on sort of a breakdown of our enrollment numbers, the demographics of the population engaging with our services. The first thing to note is that we have a bit of a data lag, so these are numbers through July 2019. Our partners at Research and Data Analysis over at Department of Social and Health Services pull this data for us and are able to break it apart into some pretty great detail. They provided us with the original forecasting model that we're using for caseload for the program. And as you can see, 2019, we really took off in terms of enrollments and are ahead of the forecast for where we were predicted to be at this point in time. And I can say that to date, so as of December 1st, we have over 6,500 clients currently enrolled in the program. And I would say, interestingly, more enrollments on the clients who are receiving supported employment services. It was almost a 2-to-1 enrollment, so towards employment over housing. We were very surprised early on in the program to see the sheer number of engagement with or interest in the employment services. And now we're almost, at this point, equal in enrollments in housing and enrollments in employment. And taking a closer look just at some of the demographic information on the supported employment side, 32% are any minority, slightly higher number of males enrolled in the employment piece.
Next slide.
Next slide. And on housing, it's a pretty 50-50 split in gender between male and female, and similar minority enrollment in the program. And age distribution for both of these, 25 to 64 is where the large majority of our enrollments fall age-wise. And looking again at supported employment clients, really interested to see such a high number of our Medicaid expansion population. 54% of our enrollees are in that population. Slightly, so 30% are in the categorically needy category, with 17% overall Medicaid and receiving Medicaid and Medicare, so duly eligible. And on the housing side, slightly higher in the categorically needy, slightly lower on the Medicaid expansion population, and similar numbers in the duly enrolled, 20% Medicaid and Medicare. And so just looking at the other housing assistance programs, so looking at the employment side, it's really interesting to see that we have it's not a requirement for eligibility to receive supported employment services, but we have a 12% of our supported employment enrollees qualify or meet the criteria, the HUD criteria for chronic homelessness. And almost 30% are referred for housing and essential needs. And for supportive housing, we have 32% on the HEN, referred for HEN services, and 25% chronically homeless. And the last thing I would like to say, and we don't have a slide on this currently, but just looking at our provider network over the last 2 years of the program, we're in every county. We have 133 contracted agencies delivering services in over 370 sites statewide. And on our last slide, we have contact information for our third-party administrator, who's AmeriGroup. They are the provider who's the contracted administrator of our provider network. So if you are a provider in our community and you're interested in receiving more information, here is their contact information. They have a resource website for our providers as well as a resource site for people who are interested in receiving FCS services.
And it's important to note that to become enrolled in FCS, you can be referred by a provider, but you can also just refer yourself. So if you're aware of somebody who might be interested in the program, they can contact AmeriGroup directly and essentially self-refer, and then AmeriGroup will look for a provider in their area that has the capacity to serve them. And we just have go ahead.
Oh, this is Melody. I just wanted to touch on the resource guide to technical assistance. So this is the document that has the staff from from DBHR as well as our sister agency at Aging and Long-Term Care Services and all of their staff that are providing technical assistance to agencies. And so if you're interested in receiving additional technical assistance for your agency on FCS, here's the link to that resource guide that has the contacts for all of the staff in the region. Sorry. So I think if there's nothing else, we have one more slide. Oh, that's it.
Just our contact information. But if you have additional follow-up, here's how you reach us. And please feel free to reach out. We all check our email, and we are all fairly responsive to it.
So why don't we open it? I'll turn it back to you.
All right, sounds good. Thank you guys so much for your expertise and sharing some knowledge with us about FCS. So now is an opportunity for, if we have any attendees that have any burning questions or have anything they want to have us discuss, please let us know just through the questions panel. And while it's going to sometimes take a little bit of time for people to kind of think of questions and queue them up, I actually had a couple of questions as we were going through the presentation. Do we have any FCS-specific events that are coming up at the beginning of the year that folks might want to know about?
We do, and they are all in the Foundation's newsletter, so they are listed. So on one of the side panes of the newsletter, we have all of the events that are coming up. So every month we have a monthly topical webinar on housing, and every month we have a topical webinar on employment. We have a Job Developers Learning Collaborative meeting that we host, and we have quite a number of in-person events that we host and do trainings for, and so those are always all posted on the Foundation's newsletter. So definitely encourage people to sign up for the Foundation's newsletter listserv. We also just try and provide other resources and information, updates on our enrollments. So there really is we're trying to give quite an array. I think there was a calendar at one point. So there's the calendar of events, the Healthier Washington calendar of events. And so that's another opportunity to go. And then just, you know, again, our trainers all also have listservs. I think there's a Gov Delivery listserv that you can get announcements for activities and events. So feel free to sign up for any of those things, and we'll get you we'll give you information.
All right. So again, just to reiterate, so at the end of this webinar, we'll make sure to send all of the folks who have registered for this a link to the PowerPoint, a link to the recording, and I'll also provide some resources. And so I'll make sure to put in a link of how you can go and sign up for Foundations, which is the FCS newsletter that Melody was just talking about. And if there's any other resources that pop up, I'll make sure to include those as well, so you guys will be in the loop. And it looks like we have our first question.
So the question is there a plan to roll FCS services into the Medicaid state plan through a SPA or some other way? That's a great question, because we are 2 years into FCS, but 3 years into the 5-year demonstration waiver. And so, yes, we are starting to explore what are our sustainability options. And so we're still looking at all of those things, and including a state plan amendment or an extension. And so it's still, we don't have one specific strategy yet. We're still working and exploring what sustainability looks like for FCS. So we'll keep you posted probably in the next year with more information.
Great. And we just have one of our attendees share some information that AmeriGroup offers a monthly Q&A webinar as well.
We do,
so,
thank you.
We will make sure to grab that and make sure that it's included in the resources email that we send out, so folks are tuned in for that.
AmeriGroup, our third-party administrator, has been very attentive to launching this very innovative program, and they also do quite a number of events and activities to help promote FCS as well. And so they've been a tremendous partner with these unique, innovative services.
Okay, so I think we might still have, do we have any others that come through? Okay, so I had a question. We were talking about the Pathways to Housing site and how it's relatively new. I'm curious if we plan on, or if we know of any additional resources that we plan to put on that particular site as we're still kind of growing the site.
We definitely have a lot of ideas. Unfortunately, the funding streams, for expanding that are somewhat limited, and so are challenging. And so I think actually we were just brainstorming some ideas yesterday. We'd love to probably do a little bit more on the financial literacy, and maybe even some financial literacy online curriculum to help people learn how to manage their funds. And so financial literacy is certainly a strategy. So that's one thing that stands out in my mind. Would love to build that out more. If I had a dream, it would be to actually have an online rental application that all landlords could use. And so that individuals, every time a person goes and applies for to a private market landlord, it's often, there's an application fee, $30, $40, $50 to, and if we could actually have a universal generic application that landlords could use from that site, could that help reduce those costs of those application fees and on the individuals? There's a lot to do with potentially doing that, but I would love to see that potentially in the future. And we do have the master application on there, but landlords, it's certainly right now only for that individual to be able to go and use that as a cheat sheet as they're going and paying and filling out their individual applications. So, but if there's a way that you could send that to a landlord, that would be fantastic. That's probably many years away.
All right, thank you so much, Melody. We've got another question.
Is financial literacy encompassing of benefit planning or separate? So benefit is probably separate. I think benefit planning is a little bit more focused on On the employment side, it's been historically focused on how working affects governmental benefits. And so how working is going to affect that person's food assistance. And certainly there may be a little bit of financial literacy in preparing that person for the impact of how working affects benefits. But I think on the housing side, it's a little bit more focused on how do you budget your rent with your income, with your utilities, with your food costs. And so it's also maybe also working towards home ownership. And so I would say the financial literacy on the housing side is a little bit more focused on financial. They certainly could dovetail together and complement each other, but historically benefits planning is a separate service that's really more focused on how working affects benefits, governmental benefits. It's oftentimes very fearful. It's often, very fearful for people that are, especially on SSI or SSDI. If it's been taken sometimes on average 5 years to get onto SSI or SSDI, to go back to work, is pretty scary for individuals. And so to give people as much information so that they can make informed decisions about that. And so we totally recognize that, going back to work is scary, but it's really healthy. And it's important that you have that conversation with an individual that it's better for your health to go back to work, and I'll support you during this process of how working affects your benefits, but being unemployed is bad for your health. And so you really have to have that it's almost like negotiating with that person. You have to educate them about the negative impact of being unemployed for long periods of time. It's healthy. It's where we meet people. It's social. It's, I could do a whole webinar just on the benefits of employment. It is a little bit of my soapbox. So I think that we don't do enough to really have those conversations with individuals about employment and how important. It's not to say this is a work requirement. It's to say that how can I support you? What does employment look like for you? It may not be what you used to do. What is that? What do you need to be successful? And so those are all tenets of the supported employment program.
All right. Any other questions? We're kind of starting to dwindle down a little bit. As we're kind of wrapping up the webinar, do you guys have any final thoughts, anything final or last that you would like to share with attendees today about FCS?
I think it might be helpful to clarify, in case folks don't know, what a third-party administrator is. So AmeriGroup is our third-party administrator. That means that when you become a provider for FCS, you don't actually contract directly with the healthcare authority, you contract with AmeriGroup. And AmeriGroup, if you're interested, contact them on one of the links that we provided on one of the earlier slides. They will provide technical assistance to walk the prospective provider through the contracting process and help them get to the point of contracting. It's separate technical assistance from what we provide through DBHR. So they'll walk them through how do you become a contractor, what are going to be the requirements, what are the certifications you need to do, whatever, how do you get an NPI number. We can work with that prospective provider at the same time about how do I actually set up the program, what are the nuts and bolts of having an employment specialist on staff, what does fidelity model mean for permanent supportive housing, or for individualized service planning for employment. So just to be aware that when you contract, you're not contracting directly with us, and that there's also technical support, technical assistance available to make that process work.
One of the common questions we do get, and that was a great summation of the TPA, is because our TPA is also an MCO, a managed care organization, can an individual be enrolled in the other managed care plans? And yes, they do not. That they can be in any of the other 4 MCOs and still get FCS services. So I just want to that's a common question that we get. So I just want to say thank you to all of our providers. Thank you to our partnerships, RDA and Department of Commerce and ALSA and Voc Rehab and all of our CAP agencies, all of our providers that are out there doing this work and helping people with these really crucial social determinants of health. Special thanks to our third-party administrator for the great job and that they've done to launch these services in the 2 years since we went live with FCS services. It's been a wild ride, but boy, we've helped a lot of people over those 2 years, and that's fantastic.
All right, this concludes our webinar. Thank you all, and again, you'll be receiving an email soon. And thank you to our panel today. Thank you guys so much for being here, and we look forward to the next one.